Today, we're digging into the hidden risks of a super common pain pill.
Get this, in 2024, gabapentin was the fifth most prescribed drug in the US. Doctors often give it for nerve pain. It's seen as a safer opioid alternative. But does a new study show a risk you need to know about? Okay, let's get into it. So, the big headline here? These drugs are linked to a higher risk of drug poisoning. We're talking about a class of drugs called gabapentinoids, and the risk is highest right at the start.
How high? Well, the risk of being hospitalized for poisoning shot up 81% in the first month.
But here's where it gets really serious. When you mix it with other common medications.
So, taking them alone is one thing. But mixing them? That's when the risk really multiplies.
Just how much? The risk jumps 4 times higher? When you also take benzodiazepines, the stuff often used for anxiety or sleep. And it's not just that. The risk also doubles when they're combined with opioids. Seriously, this interaction is a huge deal. So you gotta ask, with these risks, why are these drugs so incredibly popular? Well, their popularity exploded as doctors looked for safer options than opioids for chronic pain.
And look, this isn't the first warning we've had, but this new study has the clearest data yet.
So, how did they figure this out? They crunched the numbers on 1.35 million patient records. They use this really smart method where each person is their own control. It's super powerful. All right, so the big question is, what does all this mean for you? Let's break it down. The study's authors are pretty clear. Doctors need to watch patients really closely at the start. And for patients, it's all about being aware and talking to your doctor about all your meds.
Which leaves us with a huge question. How can we better balance pain relief with patient safety?